end if possible.
I did just now.
Good evening, parents. We are delighted to have you to join us in this informative and interactive live session aimed to help you understand more about RSV, that is respiratory syncytial virus, and why it is a cause of concern amongst all the viral infections. So, while the conversation around COVID-19 and seasonal flu have been in the spotlight over the past few years, respiratory syncytial virus, or RSV, we say, has been the leading cause of acute respiratory illness in our country. According to the World Health Organization, RSV is responsible for 3.6 million hospitalizations and around 1 lakh deaths in children below the years of 5 below the years of 5 years of age. Nearly half of the deaths are seen in infants who are less than 6 months old, and incidence is higher in babies who are less than 2 years of age. Fortunately, RSV can be prevented with proper immunization and taking some special necessary measures. So, in this session, we will learn about the immunization and prevention strategies that can help alleviate the risks of RSV infection in the children. For this workshop, we are privileged to have Dr. Kiran More, Senior Consultant and Head of Neonatology, Thane. Dr. Kiran More is an Australian board certified neonatologist. He is trained at top institutions in Australia, Canada, New Zealand, and Melbourne. He has served at prestigious hospitals in Mumbai, Qatar, and New Zealand. With his extensive expertise in neonatology and pediatric critical care, he's also a medical influencer, spreading his knowledge to the general community. Dr. Kiran More, thank you so much for joining us today. Please
Thank you.
share your thoughts on the topic today.
Sure. Thank you. Thank you, first of all, for inviting me on this live workshop. I'm pretty excited, and I hope you can try answers parents' common questions regarding this new topic, which a lot of parents have not even heard. So I'm excited to join this.
So moving on, doctor, I'll start with my first question. So Dr. Kiran More, my first question to you is, what is RSV? Is it as serious as the COVID-19 infection that we all know about?
Well, you can say consider it as serious because I think COVID got its highlights because of the pandemic. But this is another respiratory syncytial virus. It's a type of an RNA virus. Say one of the many more viruses existing like flu viruses. But considering its virality, that means how it can spread and how serious it can be, it needs to have it needs to receive more attention. So it basically causes it has got a special property and the special structures which helps it to penetrate the lower respiratory tract system of the babies, especially newborns and infants. Population less than 1 year and extreme newborn populations are vulnerable to this, and it can cause serious illnesses requiring breathing support or even ventilation for that matter. So, and it is very underdiagnosed because we don't readily test it, and that's why a lot of parents must be surprised to even hear this for the first time, that COVID and flu is everyone aware of, but RSV, it is equally dangerous, and in fact it can be more dangerous in certain populations which we will be talking about. So yes, it needs equal attention.
Thank you so much, Doctor. That was incredibly insightful. Before we go any further, I would like to invite all the parents once again. During this workshop, Dr. More will be answering all your questions live to help you make more informed choices when it comes to your child's well-being. Moving on, Doctor, how is RSV different from the common cold or flu that we all know about?
Sure. So initial symptoms might mimic like a common cold only. So you start off with a runny nose, cough and fever, which is common in many viral infections. But many babies actually progress pretty quickly to lower respiratory tract infection. So as I was mentioning, this virus is very virulent and it has ability to spread into the lower part of your breathing canal. So that's why it causes breathing difficulties. It causes wheezing, which you see it in asthma. So it produces a lot of secretions which actually block off the airway, and because of that, the airways can go into the spasm. So they get like this whistling sound, which is called as wheezing in medical term, and that's why they continue to breathe very faster. And then obviously their activity goes down. They refuse to feed, and surprisingly, you will, as per the Western data, almost 90% of these bronchiolitis, what we call, which are the lower respiratory infection associated with these viruses, are due to RSV, and it is the second most common cause of death within 1 year. So it may start off as a simple viral flu, but it can be really dreadful, and that's why we should be aware of it.
So, doctor, how can we differentiate between this common cold, normal cold, or RSV?
Right. So, see, initially, as I said, initially the parents will feel the symptoms are pretty same, and even for the doctors, for us to on first day of illness or second day of illness, it might just behave like an ordinary flu. But as the symptoms progress very rapidly, and as I was saying, what we clinically differentiate a baby is having lots of cough and secretions. Many times, these smaller newborns and infant, we see a bit of a collapse on the right side of the lung, because the secretions, they block your lungs, the wind pipe also, and it can collapse the lung, and that is very classical. And then, if you are suspecting there could be an RSV infection, the only way to differentiate and test is there are these viral panels which are available, which actually test the RSV virus, and there is a panel available which it tests about 4 5 different viruses, including RSV. So the diagnostic and confirmatory is the we have to send some secretions to the lab so that you can grow or detect the RNA of this virus, and then you can diagnose it for sure.
Before we move ahead and before we continue with other questions, I want to let all the parents know that we are taking questions on this live session. If you have any queries related to this topic that we are discussing today, please feel free to write them down here in the comment section and Dr. Mori will surely address them. Moving on, Doctor, why are infants and newborns more vulnerable to RSV?
Correct. It's a good question. And that's where the parents who have the babies who are young and who are born premature, particularly, they should be more careful. So basically, the newborns have immature lungs and immature immune system. So their disease fighting capacity is little lesser compared to the older children. And also, they don't get any particular protection or antibodies from the mother. So in Western world, the mothers are getting RSV even vaccine. So when mother who is pregnant, she gets a vaccine. These antibodies, which are our fighting soldiers, which fight against the RSV, they get transmitted to the baby through mother's blood, or even for that matter through the mother's milk. But because we don't have a vaccine available for mothers, these babies, especially the newborn babies, are particularly vulnerable for this RSV. And there are lots of studies talking about what is the vulnerable population among this. What do you mean by vulnerable? Those are at higher risk. So all the preterms born less than 36 weeks of gestation, which are called as technically premature, are at risk maybe 2 or 3 times. But the highest risk is for those babies who are born very premature, like less than 30 weeks or less than 28 weeks gestation. So almost 3 months earlier than their due date. Those are very much at risk because of the poor immunity and poor lungs, because they don't have only weak lungs, but their lungs also develop little abnormal compared to their normal counterparts which are born on time. And also those babies who have heart diseases, where there is some kind of a connection between the heart and lungs, or where there is a lot of blood going to the lungs, these babies are particularly at a very high risk of developing this RSV infection. So that's why we have to be very careful for the babies if they are born early, they are premature, and if they have a heart disease, and especially if there is a RSV season, we have to be a bit extra careful.
So, doctor, talking about how contagious is this RSV? And how does it spread from one child to another? If you could help us understand that.
Sure. So RSV, for like for all other viruses, it's droplet spread we called. I think COVID has made our life easy to explain parents now because everyone know the contact precaution by heart because so many videos were running during COVID times. So like COVID or like flu, RSV also spreads by droplet. That means if you cough or you sneeze, and if your hands are contaminated, you sneeze on your hands are contaminated, or you sneeze loud and then your whole surface is contaminated, then any other person touching those surfaces or shaking your hands, or you're directly sneezing on somebody, you can spread these viruses. And the other special property of the virus, which is applicable for many other viruses, that even outside of the surfaces it can survive for almost 6 hours, or even on the hands for 30 minutes if you have not washed your hands. So it's not that somebody has to sneeze in front of you. If they have sneezed 30 minutes ago and then they're shaking hands, they can still transmit the virus. And all this contaminated surface up to 6 to 10 hours, it can transmit the virus.
Now, thank you for reminding us how contagious these infections could be. Moving on, you also mentioned about
Yeah,
the
just
season.
sorry to interrupt. That's where I think in COVID time also many people were saying why Indian culture of saying namaste actually comes out from that. When you don't shake hands, the Western culture of shaking hands is actually putting you in the risk of spreading all these viruses. So when you say namaste, actually to everyone, that actually prevents this risk of direct contamination. Sorry, yeah, I can go ahead.
Definitely. Now, moving on, Doctor, you mentioned about the RSV season. I would like to highlight that and want to understand. So, when is this RSV season in India? Are there any specific months we should be more cautious about or during
So
that period?
yeah. So we have very limited data on this because testing of the RSV has not been extensive. So the studies are very limited, but still we have a good data showing that generally all the viruses they flare up during the winter season. Actually, worldwide this is shown. So in India also, in winter seasons you will get flu. Similarly, you get RSV also. But in India, we have a separate rainy season. So in rainy season also, we see a peak of the RSV. So it's kind of a bimodal peak. So starting from somewhere in June, July, and extending up to maybe Jan, end of Jan, is the season. Once the temperature starts getting warmer, again depending where you live, like in Mumbai and all, it gets really hot between February to May. So then in that season, the viruses don't survive in the higher temperatures. So you're a little protected. But in rainy, particularly, and winter season, so June till Jan is the high risk in most of the states in India.
So, and what are the early warning signs of RSV in babies?
Right. So actually, many times early signs will be, as I said, was like flu only, but within few hours or sometime within a day or so, these babies might having faster breathing. They will have poor feeding. They don't latch on to the breast for long period of time. They might be irritable. They might breathe faster. So you might see some chest indrawing. In the chest or also in the abdomen, you see the chest is going inside, and the nasal flaring, the nasal, you see the obviously other signs of breathing difficulty, and then cough. They get like bouts of coughs coming, and also a lot of secretion, lot of cough mucus. They bring it out, and that's why when you see the child is behaving little unusual than a normal flu, then obviously you need to go and see your pediatrician or maybe an emergency department in a pediatric hospital.
So now we have talked about the infection. We have also talked about the season, the signs of the infection. Now let's talk about the prevention, doctor. Can RSV be prevented with any vaccinations?
Sure. So I think we lost Neha a little bit here, but yes. So the question is whether can RSV be prevented? Yes. Till now, maybe till last year, Unfortunately, we did not have any means of preventing RSV. As I mentioned earlier, the maternal vaccine is not there in India yet, which is something has not come yet. But if you give vaccines to mothers, then the babies also will get indirect protection. So that is not there yet. Uh, and But there are these immunoglobulins which are available. So what are the immunoglobulins? So whenever you give a vaccine for any kind of vaccine to a child or baby or even for adults, your bodies will produce this fighting antibodies or immunoglobulins, and these are our soldiers which actually fight the disease, and they have a memory that okay, this is the bug. Next time if it comes, you have to fight it. This is your enemy. So these memory antibodies are created. So now these antibodies, these monoclonal antibodies are available in India because obviously they are not vaccines, they are antibodies which are generated from from the animals or pooled serum. So they are extracted from the live animals, and then they get compiled, and that's why they are very expensive. But they give direct protection to the baby. And so we have two forms of these antibodies, monoclonal antibodies are available. One is palivizumab, and the other is nirsevimab. These two are there, and palivizumab has been in the market for almost 15-20 years, and nirsevimab also for last few years. And I've been working as a neonatologist dealing with a lot of extreme premature babies. We had to import this in India. When I was overseas, it was very readily available, was provided by the government. So the whole cost and everything was taken care of. So the parents never have to think about it. So we used to give it for all the babies who are at high risk. And what again, as I mentioned earlier, what are the high risk are the babies who are born extreme premature. So those less than 30 weeks probably, or those who have a heart disease, they used to get 2 seasons covered. So once they get discharged, we used to give them this palivizumab and then repeat it on the next year. So till last year we had to import it. We had to really put up a request and import especially for this for every baby, and that used to work out very expensive. And now but it is routinely available in India. The palivizumab came last year in November, and the nirsevimab came just this month July, and we had given it to some of our high risk babies. So luckily they have almost 90-95% protection. Obviously no viruses, no vaccines or antibodies can give 100% protection, but it's a reasonable protection. And that it has shown to reduce deaths also, and also morbidity, which means that maybe the length of stay in the hospital is less, or the babies get less sick. So they might need oxygen, but they may not go on ventilator, because we have seen certain cases which were really sick that they need ventilation, or babies need to put on the breathing machine for very long period of time, including that's one baby who was extreme preemie, who came back with an RSV infection, and we had to put this baby on ECMO. So ECMO is like a heart lung bypass, and that baby was really sick, so much so that we have to put the baby on ECMO. So that's why this RSV can be really dreadful. So if you can prevent it, that's well and good.
And what are the important preventive measures that should be taken after the baby is born?
Right. So again, I think the first 3 months are very crucial, even if the baby is born on term, and if the baby is born extreme premature or premature like less than 36 weeks, first 3 to 6 months, the immunity is not that much. So they are uh, they are basically protected with mother's antibodies. So mother doing breastfeeding is very essential because it's not only for the nutrition, but also to give those antibodies from the mother for various viruses which she might have infected in during her lifetime. So exclusive breastfeeding, taking care of the newborns, especially avoiding any contact with any sick relatives. So even suppose parents are sick, you don't have to isolate them, but you have to do contact precautions. So those all COVID precautions: sneezing with the elbow, don't get your hands contaminated, do frequent washing of the hands. If mother or father is sick, then probably they have to wear the mask continuously, and every time before you lift the baby, you wash your hand or at least put a hand gel. if anyone else is coming out, in India, everyone, a new baby is born, everyone get excited, everyone wants to lift the baby, kiss the baby. So even kissing the baby directly on the mouth or close to the mouth or nose can actually transmit this virus. So, we often tell them that, okay, I know you want to express the love, but, be careful that you don't spread the viruses to the newborns. And unfortunately, RSV, flu viruses, and there are certain cold viruses, something called as rhinovirus. You can actually carry, an adult can carry it without any symptoms, but it can be spread to a baby, a newborn baby. So that's why kissing closely, outsiders coming out directly rushing lifting the babies, that should be avoided. You should do a good hand washing, all hand hygiene practices once you come in contact with the baby, especially first 3 to 6 months. Then beyond that, it is little better. The babies do handle it better.
And doctor, can this RSV be transmitted from a mother to the baby in the womb itself?
The transmission of is not through the womb, so transplacental is not there, so which is a good thing. So like certain viruses like HIV and all, they can get transmitted, but luckily the RSV doesn't get transmitted via blood or via the placenta. But the antibodies can get transmitted via placenta, which is a good thing. So protective antibodies can get transmitted, but not the virus. So only way is the contact with the baby. If the mother immediately after the delivery she's suffering from RSV, she can transmit it to the baby, but not before delivery.
Now we have a lot of questions coming in from the parents who are watching this live. To
Okay.
start with, we have a question coming in from Kritika who wants to understand, अगर दोनों पेरेंट में से किसी को भी आरएसवी हुआ तो क्या बेबी को भी हो सकता है? What would you suggest?
करेक्ट कृतिका, सो यस यू आर राइट कृतिका, हो सकता है अगर मम्मी या डैडी दोनों में से किसी को हुआ है, तो जैसे नॉर्मल वायरसेस फ्लू होता है या दूसरे भी होते हैं वायरसेस, वो स्प्रेड हो सकता है। और हम देखते हैं जनरली घर में एक जन बीमार पड़ जाता है तो सारे फैमिली मेंबर्स घर में बीमार पड़ जाते हैं। और इंडिया में हम बहुत बार साथ में ही सोते हैं, बेड पे ही सोते हैं, तो ट्रांसमिशन का रिस्क है। तो जैसे मैंने पहले कहा कि हाउ टू डू लिटिल बिट ऑफ कॉन्टैक्ट प्रिकॉशंस, आपको बेबी को आइसोलेट करना नहीं है। अगर फादर मदर में से एक है, अगर आपका बेबी अगर प्रीमेच्योर है और हाई रिस्क है, तो मे भी हो सकता है कि फादर थोड़ा सा दूर सोए, थोड़ा सा सेपरेशन मेंटेन करे। अगर दो बेबीज हैं, एक ओल्डर टॉडलर है, उसको अगर इन्फेक्शन हुआ है पहले, तो हो सकता है थोड़ा सा अगर आप डिस्टेंस मेंटेन कर पाए, जितना हो सकता है उतना उतना अच्छा है। और सबसे इम्पोर्टेंट है हैंड हाइजीन, wearing mask for the person who is infected and putting gel all the time before handling the baby. So risk है तो ख्याल रखिए बस।
Moving on, we got another question coming in from Shima, who is asking, pets से भी RSV लग सकता है क्या बेबी को? We have two cats at home.
गुड क्वेश्चन। तो पेट ट्रांसमिशन रिपोर्टेड नहीं है, मतलब उसके ऊपर कोई स्टडीज भी नहीं किए हुए हैं। और आरएसवी जनरली आई थिंक पेट्स को नेचुरल प्रोटेक्शन होता है, एंड अगेन देयर आर नो स्टडीज टू शो दैट इट कैन बी ट्रांसमिटेड। सो जनरली पेट ट्रांसमिशन सेफ है, so it doesn't get transmitted unless the pet is infected. Then there is always a theoretical possibility, but there are no studies who have proven that this might be transmitted. So generally pets are safe.
Hopefully, Shima, that was helpful to you. Moving on, Sangeeta is asking, मैंने सुना बेबी को किस, the same thing that we were discussing right now. Sangeeta is asking, मैंने सुना बेबी को किस करने से आरएसवी फैल सकता है, क्या ये बात सच है?
तो एक्चुअली फैल सकता है। तो जैसे मैंने कहा, आरएसवी सरफेसेस के ऊपर 6 आवर्स रहता है, हैंड्स के ऊपर 30 मिनट्स रहता है। सो अगर आपने ऐसे छींका है तो आपके सरफेसेस पे, मतलब आपके इवन फेस पे अगर आपने वॉश नहीं किया है, तो आपका फेस, लिप्स और नोज आपका कंटेमिनेटेड रहता है। तो अगर आप बेबी को उठाएंगे, किस करेंगे, और सी कुछ कुछ यहाँ कुछ घरों में तो बेबी को लिप्स के ऊपर किस करने की भी हैबिट होती है पेरेंट्स की। फादर आया है, आई एम अ पेरेंट ऑफ 2 daughters, so आई फील लाइक व्हेन आई कम होम आई वांट टू किस द बेबी, आई वांट टू किस द बेबी ऑन द लिप्स। तो वो रिस्क तो है। अगर आप बीमार है या आप कैरी कर रहे हो, और जैसे मैंने कहा कभी कभी हम कैरी करते हैं वायरस को, लेकिन सिम्टम्स नहीं आते हैं, तो तभी भी रिस्क रहती है। तो यस, प्यार एक्सप्रेस कीजिए, बट मे बी यहाँ वहाँ किस कीजिए, डायरेक्ट लिप्स पे किस अवॉइड कीजिए, और स्पेशली अगर आप सिक है तो किस करना भी अवॉइड करना चाहिए।
There's another question coming in from Priyanka who wants to understand. I'm 7 months pregnant and I am really concerned about how to lower the risks of RSV for my baby. Hospital तो सब relatives and friends आते ही हैं and they want to play with my baby. So what to do in this situation? What would
Yeah.
you
So
suggest?
first of all, don't get paranoid. I hope you are 7 months pregnant. I wish that you continue pregnancy till 9 months, so you deliver the baby on time. So that means that reduces your risk of RSV significantly, because as I was mentioning, those who are born premature, so less than 8 months के पहले या 7 मंथ या 6 मंथ्स के पहले जो बॉर्न होते हैं, उनको रिस्क बहुत ज़्यादा होती है। तो पहली बात, अगर आपका बच्चा समय पे आता है, you deliver at 9 months completed, then your baby will have some natural immunity to fight RSV. Secondly, yes, ये बहुत कॉमन है, एक्साइटमेंट होता है, घर में पहला बच्चा आया है, so you don't have to be rude with anyone, but maybe just politely saying that okay, baby is small, maybe we should just, you can talk to them, but maybe not everyone should lift the baby or this thing, yeah, directly kiss the baby. स्पेशली अगर कोई बीमार है तो उनको रिक्वेस्ट कीजिए कि बेटर है हम आप अगली बार आ जाइए, या फिर आप उनको बाहर मिलिए, बेबी के साथ मिलने का जरूरत नहीं है। लेकिन अगर रूम में आते हैं लोग, आपको कंग्रेचुलेट करना चाहते हैं, दैट्स ओके, यू डोंट हैव टू बी टू पैरानॉइड अबाउट इट। एज आई सेड, जस्ट कॉन्टैक्ट प्रिकॉशंस। कोविड के टाइम जो हम लोग प्रिकॉशंस ले रहे थे, वैसे टाइप्स के प्रिकॉशंस थोड़े बहुत हम लोग लेना चाहिए, कि थोड़ा डिस्टेंस मेंटेन कीजिए, डायरेक्टली आप विदाउट हैंड हाइजीन डायरेक्टली बेबीज को उठाइए मत। तो घर में आप जेल की बॉटल कैरी कर सकते हो, और एज आई सेड, पोलाइटली आप ये करो, डोंट बी जस्ट पैरानॉइड, बिकॉज आई हैव सम दिस थिंग दैट उन्होंने बंद कर दिया था, किसी को आने ही नहीं दे रहे थे। ऐसा करने का भी जरूरत नहीं है, बिकॉज बेबीज डू गेट एक्सपोज टू सर्टन वायरसेस, थोड़ी थोड़ी इम्यूनिटी होती है, वो भी एक नेचुरल एक्सिस है व्हेन द न्यूबॉर्न इज गेटिंग एक्सपोज टू सम अदर पीपल। और पेरेंट्स का भी जो इन्फेक्शन होता है वो भी बेबी को एक्सपोज होता है, बट वो एक नेचुरल इम्यूनिटी देता है। सो हमारी बॉडी में भी बहुत सारे बग्स होते हैं, ऑर्गेनिजम्स होते हैं, जो हमारे हमारे साथ सिम्बायोटिक रिलेशन में रहते हैं, जिसको जो हमको इफेक्ट नहीं करते, लेकिन हमारी बॉडी पे अच्छे से रहते हैं। तो बेबी भी जब भी आपके साथ रहता है, तो बेबी के पास भी वो ऑर्गेनिज्म जाते हैं, तो थोड़ा बेबी का इम्यूनिटी भी बिल्डअप होता है। सो that's why some amount of infection is okay, because that's helping your baby to build up natural immunity. But yes, कोई बहुत सिक है, कफ कर रहा है, स्नीज कर रहा है, उससे थोड़ा सा दूर रहिए बस।
Hope that was helpful to you. Moving on, we are getting a question coming in from Ritu who wants to understand. My elder daughter is 7. She did not receive RSV immunization. So, can she get it now? Also, can she expose my younger daughter who is 7 weeks old to RSV?
Okay, Ritu, very good question. So currently, so I'm part of the committee national committee who's writing the guidelines for RSV, and currently RSV is recommended for only less than 2 years of age, and especially only for the high risk babies. So beyond 5 years, though, use has not been established, because by that time these kids are already exposed to some kind of RSV or some other viruses. So उनकी natural immunity पहले से बिल्डअप होती है, तो अलग से वैक्सीन देने की जरूरत नहीं है आपके ओल्डर बेबी के लिए। यंगर बेबी के लिए यस, बट योर ओल्डर डॉटर कैन ट्रांसमिट RSV, बिकॉज ओल्डर डॉटर मे नॉट गेट सीरियस इन्फेक्शन, बट शी माइट गेट रनी नोज और कफ। सो वो आपके छोटे बेबी को ट्रांसमिट कर सकता है, कर सकती है। तो वो रिस्क है, तो छोटे बेबी को आप वैक्सीनेशन कंसिडर कर सकते हैं। अगेन, एज आई सेड, करंटली these are very expensive vaccines, very very expensive, not everyone is routinely can afford them, and the government has not yet made it available in the government area. So uh, it's up to the parents to decide whether you want to offer, and we are recommending it for the babies who are at high risk, who are less than 30 weeks born, less than 30 week gestation, that means 2.5 months से जल्दी पैदा हुए हैं, और और उनको हार्ट डिसीज है, सो उनको डेफिनेटली कंसिडर करना चाहिए. आई होप दैट आंसर क्वेश्चन, रितु.
Moving on, we got a question from Vijay Lakshmi who wants to understand how to know if sneezing if someone is sneezing because of RSV or the common cold. I believe this would be a common question which would pop up in everyone's mind, of
Everyone's
course.
fine. Correct. Just by sneezing, even I cannot differentiate. So, as I was saying earlier on the beginning, so sneezing is a reflex. Cough is also a reflex. You can sneeze with anything. So, if you are just runny nose and sneezing, then probably you are suffering from a common flu or a common cold, more likely. RSV, sometime again, if you have a good immunity, you will have same symptoms like flu. But in smaller babies and smaller infants, RSV progresses very fast. So you start off with sneezing, runny nose, and cough. But then babies will start having fast breathing, and they get lots of secretion, and they get a wheezing sound, like whistling sound, because of the breathing pipes, they get spasm. So that is very classical of RSV, and that we call it as bronchiolitis in medical term. That means it is little more than a common flu. They get infection in the lower airways of the lungs, so not the upper airways. So sneezing comes when you have infection in the nose and throat. And cough comes when you have infection in the throat. So when it spreads down in the chest, then you get bronchiolitis, which is a lower respiratory tract infection. So once you reach that stage, then probably you can differentiate from a flu that okay, this is something more. So you have to do a testing of the viruses by sending your swab of the throat, and then that will tell you if there is a viral infection. That's the only way to differentiate. I hope that answers question, Vijay Lakshmi.
Another parent named Sandhya wants to understand why is RSV more danger to babies? What about the adults and older children? What would you suggest?
Okay, so Sandhya, again, we covered part of it. So older in children and adults, generally they get exposed. See, the children when they start going to daycare or to preschool and then school, they get exposed to lots of viruses, and so that's why they gets infection with the RSV also. So once you get one infection or two episodes of infection, your natural immunity is built up. So next time you encounter an RSV, you will not have symptoms more than a flu. So that's why older children, same applicable for adults. By the time you reach adulthood, you have a natural immunity which is built up. But babies who are born early and they are smaller in first 6 months to 1 year, they don't have this natural immunity, and they don't get immunity from the mother also because the mothers are not immunized. But yes, if mother has got an infection, she might transmit some antibodies. So that's why breastfed babies are little protected compared to the formula fed babies, and that's why we keep emphasizing the breastfeed. Why it is important? It's like a amrit, it has got not only nutritional properties but also disease fighting capacity, it's good for brain development also, so lots of benefit, good for emotional bonding, and that's why the breastfeeding is a very important thing. So I don't want to debate on the topic of breastfeeding, but yes, older kids and adults are naturally protected. Only the kids less than 1 year or less than 2 years, up to 2 years, are prone for the infection.
Another question is coming in from a concerned parent named Preeti who wants to understand RSV वैक्सीन से फीवर चढ़ता है क्या? लास्ट वैक्सीन जो कराया बेबी को उससे तो चढ़ा था, ऐसा क्यों होता है?
हाँ, ऐसा गुड क्वेश्चन प्रीति. सो सी फीवर क्या है? फीवर है बॉडी का रिएक्शन. Whenever body feels that something foreign has come into my body, like a virus or a bacteria, the body raises its temperature to kill that virus. Because जो viruses हमारे बॉडी में सर्वाइव होते हैं, उनका भी एक नेचुरल टेम्परेचर रेंज होता है जिसमें वो सर्वाइव होते हैं. जैसे हम भी अगर एक्सट्रीम कोल्ड में हमको लेके गए या हमें एक्सट्रीम हीट में लेके गए तो हम सर्वाइव नहीं होंगे, हम स्ट्रगल करेंगे. वैसे ही वायरसेस भी एक नेचुरल नॉर्मल टेम्परेचर ऑफ बॉडी में सर्वाइव होते हैं. लेकिन जब बॉडी टेम्परेचर बढ़ाता है, अगर फीवर 102 103 जाता है, तो नेचुरली द वायरसेस गेट किल्ड. सिमिलरली जब आप वैक्सीन देते हैं तो एक्चुअली आप बॉडी में वायरस ही इंजेक्ट कर रहे हो, लेकिन वो वायरस माइल्ड फॉर्म में होता है. तो बॉडी क्या करता है? बॉडी उसको रिएक्ट करता है एज अ वायरल इन्फेक्शन एंड उसके अगेंस्ट एंटीबॉडीज क्रिएट करता है। तो सिम्टम्स तो नहीं आते वायरस इन्फेक्शन के, लेकिन फीवर आ सकता है बिकॉज बॉडी इज ट्राइंग टू रिएक्ट टू दैट वैक्सीन बाय जनरेटिंग फीवर। सो फर्स्ट 24 आवर्स में फीवर आता है, लेकिन उसके बियॉन्ड नहीं आता। लेकिन फीवर आया, इसका मतलब बॉडी इज रिएक्टेड एंड एंटीबॉडीज प्रोड्यूस हो रहे हैं और आपकी इम्यूनिटी बिल्ड हो रही है। लेकिन कॉन्ट्ररी फीवर नहीं आया मतलब एंटीबॉडीज नहीं प्रोड्यूस हुई, ऐसा मत सोचना, क्योंकि कुछ पेरेंट्स बोलते हैं कि फिर फीवर नहीं आया इसका मतलब बॉडी ने रिएक्ट नहीं किया। ऐसा नहीं है। some bodies react with a fever, some body don't react with fever, but if you are given a correct vaccine, then body will start mounting the antibodies response to create this protective antibodies. तो आरएसवी वैक्सीन के साथ भी फीवर आ सकता है, जनरली नहीं आता है क्योंकि ये एंटीबॉडीज है, इसमें वायरस नहीं दे रहे हैं हम लोग। लेकिन कोई भी हम सीरम प्रोडक्ट देते हैं तो थोड़ा बहुत बॉडी रिएक्ट करता है, क्योंकि बॉडी के लिए एक फॉरेन सब्सटेंस है जो बॉडी में जाता है। सो बॉडी माइट रिएक्ट विद माइल्ड फीवर। सो वो रिपोर्टेड है, कुछ साइड इफेक्ट्स रहते हैं एंड साइड इफेक्ट्स आर ऑलवेज दैट बॉडी इज ट्राइंग टू रिएक्ट टू अ फॉरेन थिंग विच हैज एंटर्ड द बॉडी। सो इससे डरना नहीं है। फीवर आया तो पैरासिटामोल देना है। फीवर इज अ फ्रेंड, never feel, I think this is a big question. I always keep telling my parents that fever is a friend. Don't consider, parents get panicked when fever आता है। तो fever आपको बेबी को help कर रहा है to get rid of the virus. So don't worry about the fever. Only worry with the fever is sometimes they get fits because of very high temperature. That's the only risk. Otherwise fever per se is very harmless. So it has to be just controlled with medicines and a little bit of sponsor. Okay,
I'm
I
sure
hope
this
that's
was very much helpful to the parents who are watching us right now. Now we have another parent named Trisha who wants to understand RSV vaccine से फ्लू होने के chances भी कम हो जाते हैं क्या? What would you
नहीं,
suggest?
absolute unfortunately no. सो आरएसवी वैक्सीन से सिर्फ आरएसवी प्रोटेक्ट होता है, उससे फ्लू या ऑल 100 वायरसेस है जो प्रिवेंट नहीं होते हैं, बिकॉज इट इज अ स्पेसिफिक एंटीबॉडी फॉर दिस स्पेसिफिक वायरस। उसकी मेमोरी क्रिएट हो जाती है, तो वो मेमोरी विल एक्ट ओनली ऑन आरएसवी। उसके अलावा बहुत सारे वायरसेस है जो फिर भी हो सकते हैं, बेबी को फ्लू भी हो सकता है, बट जनरली इसलिए हम लोग फ्लू वैक्सीन भी रिकमेंड करते हैं। जो कॉमन इन्फ्लुएंजा है वो सीजनली आता है, और हम जैसे स्मार्ट हो रहे हैं वैसे वायरसेस भी स्मार्ट हो रहे हैं। सो दे आल्सो कम अप विद न्यू न्यू स्ट्रेन। जैसे आप अभी देख रहे हो कोविड नया स्ट्रेन लेके आया, तो सेम कोविड नए कपड़े बदल के आता है, वैसे फ्लू वायरसेस भी नए कपड़े बदल के आता है। सो इसलिए हर साल अलग अलग वैक्सीन बनता है उसके अगेंस्ट, वो स्ट्रेन के अगेंस्ट जो कॉमनली पाए जाते हैं, और इसलिए हर साल फ्लू का वैक्सीन भी लगाना होता है, जो अभी इंडिया में धीरे धीरे कॉमन हो रहा है। पहले हम नहीं लगाते थे, लेकिन हम प्राइवेट में सजेस्ट करते हैं कि आपने हर साल फ्लू लगाना चाहिए, बिकॉज एक वैक्सीन से आपका सीरियस फ्लू इलनेस कम हो जाता है और स्कूल के एब्सेंटिज्म कम हो जाते हैं। सो इट इज हैज गॉट लॉट ऑफ बेनिफिट्स। लेकिन यस, फ्लू का वायरस फ्लू के लिए रहता है, आरएसवी का वैक्सीन आरएसवी के लिए रहता है। उसके अलावा बहुत सारे वायरसेस और हैं जो थोड़े बहुत सिम्टम्स कर सकते हैं।
And what are the chances that a child gets RSV if they are not immunized? This is the question from Mariam.
Yes, Maria. Good question. So, what are the chances? So, again, as I keep saying, that the babies who are born early, who are premature, who have premature lungs, premature immunity, or they have some kind of heart disease, they are at a higher risk, 2 to 3 times, or sometimes even 5 times risk of getting this infection and manifesting. So, it's not only getting the infection, but manifesting with a serious infection. But the older babies generally they handle it better, so they may not manifest with a good symptom, with a serious symptoms, but they can still get it if somebody else nearby is having the infection, RSV infection. So that's why the risk is high if you have somebody sick in the house. If you are living in a joint family, or there are 3 4 kids, and always you see those kids keep getting sick often because one or the other kid is carrying some viruses, including RSV virus, so they can spread to your newborn or your toddler. So risk is higher in a special population and in the smaller babies. As they grow older, this risk goes down because they build a natural immunity.
There's another concern coming in from Shweta who wants to understand RSV से क्या केवल न्यूबॉर्न बच्चों को खतरा होता है?
राइट, सो न्यूबॉर्न कोई नहीं, फर्स्ट 1 ईयर या 2 ईयर तक खतरा है। न्यूबॉर्न्स या फर्स्ट 6 मंथ्स में थोड़ा खतरा ज़्यादा होता है। और हम देखते थे, यहाँ पे भी आता है, और ऑस्ट्रेलिया या अपने जहाँ पे न्यूजीलैंड में भी था, तो दिस बेबी यूज्ड टू कम अप विद सडनली बेबी गेटिंग सिकर ओवरनाइट एंड देन दे स्टॉप ब्रीदिंग, दैट इज कॉल्ड एज एप्निया। सो ये न्यूबॉर्न्स में थोड़ा एप्नियास के साथ भी आते हैं सिक्रेशंस के वजह से, तो वो खतरा थोड़ा ज़्यादा होता है। जैसे बच्चे बड़े होते हैं वो खतरा धीरे धीरे कम होने लगता है। सो बट मैक्सिमम खतरा अप टू फर्स्ट 2 ईयर्स है, और और सबसे ज्यादा फर्स्ट 1 ईयर में है।
Another parent named Madhvi wants to understand my baby is 2 months old, so can she still get the shot?
Can she get the shots?
Yeah.
Well, as I was saying, when we wrote the national guidelines, we are not recommending it for more than 2 years right now. So the new nirsevimab which has come up, it is practiced as in many countries in many developing world. They are practicing it, giving routinely for all the babies, and especially those born less than 36 weeks up to 2 years. So if you have your child has crossed 2 years, then probably it's not required. Below 2 years, it is your personal choice. If you want to give that protection, you can do it. But we are recommending it specifically for a high risk population, because these medicines are talking about one injection around 40,000, one single dose in nirsevimab, and the palivizumab is around 18-20,000, 5 injections, so something like 80,000 to 1 lakh rupees. So it's a lot, quite a expensive this thing. That's why we are recommending it currently to restrict it to the high risk population only.
We discussed about the breastfeeding and its effects. Related to this, we have a question coming in from Deepshikha who wants to understand can breastfeeding help lower the risk of RSV? If my twins are exclusively breasted with, will they still need the immunization? What would you suggest?
Yes, so breastfeeding, as I was saying, that breastfeeding will help to some extent, but again, unfortunately, in India, there is no maternal vaccines. So if you would have been vaccinated, you would have transmitted the natural immunity via breast milk also. So now we don't know your status of the RSV antibodies, but if you would have had an infection in the past, there will be some antibodies which might get transmitted. But the real protection happens via breastfeeding is when you get vaccination shot during pregnancy, then you have a very good level of antibodies. Those soldiers, it's like, you have 10 soldiers versus you have 1,000 soldiers. So if you are vaccinated during pregnancy, you have 1,000 soldiers, out of which many will transmitted into the baby, and then they will help the babies, help the twins. But again, as I said, if your twins are born on time beyond 36 weeks or even beyond 32 weeks for that matter, the risk is low. So choice is yours if you want to give it or not. But if they are born too premature, less than 30 weeks, then we are recommending it at least for 1 year. First year, you have to give a protection. Some babies are at more risk, so they get a second course in second year also. So up to 2 years, we recommend to protect if your baby is born less than 30 weeks. If they had a poor lungs, they need oxygen for a very long time while they're in NICU. Some babies even go on home oxygen. So for them, the recommendation is to cover for 2 seasons, otherwise at least 1 season. But if your baby is born on time, then it is up to you. It's your choice. You can go and discuss with your pediatrician.
We have a lot of questions coming in from the parents, but unfortunately, since there's a time constraint, we'll have to end it here. Thank you so much, Dr. Mori, for joining us here and for this valuable inputs that you have shared. And, and also, thank you for all the parents who have joined us. Hope this session was really helpful to you. Thank you.
Thank you, Parent Tunes, for arranging this. I think it was very interactive, and I love to answer parents' questions live. So maybe we hope we can again connect in future. And thank you, Neha, for conducting this session gracefully. So thanks a lot. Thank you, everyone.
Thank you, everyone.